All right, today we're stepping right into the middle of the emergency room to break down a really high-stakes medical playbook. It's the timed protocol for something called status epilepticus. And this is a guide where, literally, every single move is dictated by the clock, because when the brain is in a crisis like this, every single second counts. So let's start with a really serious question. A seizure is already a terrifying medical event, right? But what happens when it just doesn't stop? That question is really at the heart of the emergency we're going to explore today, a situation where the brain is, for all intents and purposes, locked in crisis mode. Now, before we get into the step-by-step playbook of how to treat this, we really have to understand the threat itself. We're not just talking about a seizure that lasts a little too long. This is a full-blown neurological emergency, and it can have absolutely devastating consequences if it's not handled fast and, more importantly, correctly. And here's the official medical term for it: status epilepticus. If there's one thing you take away about this, it's that this is a time-sensitive emergency. You can think of it like an electrical fire in the brain that just refuses to put itself out. And every moment that ticks by, the risk of permanent damage goes up. That's exactly why the response has to be so incredibly structured. So this is the game plan, our treatment roadmap. You can see it's broken down into these really critical time windows. We're going to start with the immediate response, then see what happens if that fails, and finally look at the intensive care phase. It's a very carefully designed, escalating ladder of intervention. So it all starts in those first 5 minutes. The second a persistent seizure is identified, that's it. The clock is officially ticking and the medical team has to kick into high gear. Now, you might think the first step is to immediately pump in drugs, right? But actually, no. The number one priority is stabilization. The team immediately focuses on the ABCs. That's airway, breathing, and circulation to make sure the patient is physically okay. They also do a quick blood glucose check because, sometimes something as simple as low blood sugar can trigger a seizure, and that's a much easier fix. And you can really see that critical moment captured here. The focus is all about that immediate, hands-on care. You've got to stabilize the body and get the vitals under control while you're getting ready to treat the brain. Okay, once the patient is stable, it's time to bring in the pharmacological first responders, and that's a class of drugs called benzodiazepines. These are designed to act really, really fast to interrupt that seizure activity that's firing off in the brain. What's great is that the protocol has different options built in for the chaos of a real emergency. So if the team can get an IV line in quickly, fantastic. They'll probably use lorazepam. But let's be real. In a crisis, getting an IV can be incredibly difficult. And that's why a drug like midazolam is such a game changer, because it can be injected directly into a muscle. The whole point is to get the medicine on board fast, no matter what. But what if those first-line drugs don't work? What if the seizure just keeps on going? Well, this is where the protocol demands an immediate escalation. The clock has now ticked into that 5 to 20-minute window, and it's time for a new strategy. So, now the team moves to the second line of defense: anti-epileptic drugs, or AEDs. If the first drugs, the benzodiazepines, were the fast-acting sprinters, you can think of these AEDs as the marathon runners. They're designed to provide a more sustained, long-term control over that electrical storm in the brain. And again, the protocol provides choices. A drug called levetiracetam is often a go-to because it's less likely to mess with the patient's heart rate or blood pressure, which is obviously a huge deal when their body is already under so much stress. Having those other alternatives gives doctors the flexibility to tailor the treatment for each specific patient. Okay, now we're entering a much, much more serious phase. We're past the 40-minute mark. Both the first line and the second line treatments have failed. This is a critical situation, and care has to escalate to the highest possible level: the intensive care unit, the ICU. This stage has a very specific name. It's called refractory status epilepticus. And that word, refractory, it's just a medical term for resistant or stubborn. It means the seizure is fighting back against the standard treatments. That abnormal electrical activity is so persistent that the first 2 waves of medication just couldn't shut it down. And this is what that level of care looks like. The whole approach shifts. Now we're talking about intensive monitoring, usually intubation to control the patient's breathing, and bringing in really powerful anesthetic drugs to essentially force those overactive brain circuits to just shut down. At this point, the main goal is to put the patient into a medically induced coma. And this isn't just about stopping the seizure anymore. It's a protective measure for the brain. By using continuous infusions of these drugs, doctors can suppress all that chaotic brain activity, giving the brain a crucial chance to rest, reset, and recover. The medications used here are powerful anesthetics. You've probably heard of some of them, like propofol. But unlike the earlier stages, these aren't given as a one-time dose. They're administered continuously through an IV drip to maintain that protective coma until the doctors are absolutely sure the storm has passed. So we've walked through this whole intense, escalating protocol. But it makes you ask why. Why is having such a rigid time structure so critically important? Why does it all matter so much?
Well, the answer is simple, and it's everything. It is all about protecting the brain. See, prolonged, uncontrolled seizure activity can cause irreversible brain damage. This entire timed protocol is designed with one primary goal in mind: to stop the seizure as quickly and efficiently as possible to prevent that from happening.
When you boil it all down, this whole thing is built on 4 key ideas. First, stabilize the patient to handle any immediate life threats. Second, use the correct evidence-based dosing so there's no guesswork. Third, progress to the next step without delay if a treatment is failing. And all of that together leads to what matters most: improved outcomes. A clear plan like this saves lives and preserves brain function. So we'll leave you with this thought. This kind of structured, playbook approach is incredibly effective for a complex emergency like this one. And it makes you wonder, doesn't it? How many other high-stakes situations in medicine and even beyond are best solved not by improvisation, but with a clear, timed, evidence-based plan?